And welcome back to the Matt Miller radio program as we wind down hour number one. Lots to get to in the upcoming couple of hours. We're going to be real heavy in the NFL in the final hour of the program. Mitch Holtis in hour number two. PGA preview in hour number two as well. But right now it's our friends from the Iowa Sleep Disorder Center. Dr. Grant back with us to help us and help you if you are one of the many that suffer from sleep disorder. I do, Doc, today because I had a basement full of water and I fought it all night long. So this is why I look like what I do. I'm guessing that I kind of look like some of the people that you would see.
You look great.
Well, thank you very much. My wife tells me I have restless leg syndrome. Now, I don't believe I do. She's trying to convince me that I do. She's not a doctor. What is restless leg syndrome, and does it fall into your field?
Sure. Restless leg is confusing to people, often misunderstood in the lay community and even in the medical community for that matter. But what we commonly see during the day as fidgetiness or restlessness is not really restless leg per se. Restless leg syndrome is a clinical situation where people have an urge to move their legs in response to different types of feelings they have in their legs. I'll have patients describe either pain, an electrical sensation, a cramping sensation. They'll call it the heebie-jeebies, all sorts of terms. But the common denominator is if there's a triple flexion at their leg in their hip, knee, and ankle, it will alleviate it. And it only comes to bear when restless leg has gotten to the point where it interferes with people's ability to fall asleep. People will often present with a spectrum of it, but only when it comes to bear on being able to fall asleep and they cannot stop moving that it's brought to the attention of a physician or people begin to ask about it. I'm glad you brought that up because the #1 cause of restless leg syndrome is something that's very treatable and easily reversible. It has to do with iron deficiency anemia. Nothing really to do with the brain per se or sleep, but the relationship between ferritin, which is a component of iron that we use to make red blood cells, and its action in the thalamus or a part of the brain. When you correct the ferritin levels in people, there are a certain percentage of people with restless leg syndromes that will have a ferritin deficiency. Once that is addressed, the restless leg syndrome will go away. Now, there's clearly a portion of people where despite ferritin replacement, their restless legs are still present, and we give medicine to help people with that. It's very efficacious, very safe, and very easy to use. A lot of people just don't understand what restless leg syndrome really is.
Well, you know, in our final couple of minutes here, and you're with us here in the 4 o'clock hour today as we approach the 5 o'clock hour, but usually it's a different audience. So you're talking to a different audience today, and I wanted to devote a couple of minutes just to inform people what you do. Our listeners hear about the Iowa Sleep Disorder Center. They hear your commercials. The studio's named after you guys, but it really is something that a lot of people suffer from. And you guys have 2 clinics, one in West Des Moines and one in Ankeny. Why don't you tell people, you know, what it is you do, the fact that in most cases it's going to be covered by your medical insurance, and how people can really better their lives by picking up the phone and making the call to you guys?
Sure. Well, we're full spectrum sleep disorder service. We do everything from obstructive sleep apnea to insomnia, to anything that interfaces with people's ability to sleep or problems with sleep. You can be self-referred. In other words, you can call up our clinic and our facility and make an appointment yourself. Or if you prefer, you can speak to your doctor and coordinate a clinic appointment through your primary health care provider. I think that when you take a look at how we spend 1/3 of our life, which is sleeping, a lot of people sometimes cannot correlate problems with sleep to their functioning during the day, whether they're just feeling fatigued or tired or have frank health problems because of the way they sleep. We can assist in maximizing people's potential to feel better mentally and physically.
And, you know, I don't want to scare people, but, you know, if sports fans in the audience, Packer fans, that's Reggie White died because of this.
Sure, sure. That's unfortunate. And I think that there's a growing awareness about obstructive sleep apnea in the lay community as well as the medical community. The interface that untreated obstructive sleep apnea has with high blood pressure, people with diabetes, people with pulmonary lung problems, even people that have to get up and use the bathroom a lot at night. These are all connections that we can draw back to untreated obstructive sleep apnea, or what we call sleep disordered breathing.
The website is, I don't have it in front of me. Do you have it?
www.iowasleep.com.
And And everything is on there, and
Sure.
A lot of questions answered.
Yep, check it out. You can see listings of all the providers at the clinic. If you have any questions for the practice, you can email them in. Again, we welcome the referrals or the consultation.
You know, and I think you put it very well last time we talked to you about, you know, we even talked about the facility. What can you expect? He says it's not a 5-star hotel. It's kind of like a bed and breakfast. You spend the night there and you get hooked up and you're monitored throughout the night.
Absolutely, absolutely. And you'll have a consult on the front end where we kind of get to know you, what the circumstances are that bring you to the clinic. You'll get your sleep study, and then we'll meet with you after your sleep study to review the results, as well as kind of bring this to a conclusion. One of the aspects of the practice that I enjoy is the longitudinal relationships I have with the patients. It's not just so much a one-off consult, but more of a clinical relationship that I establish with my patients.
iowasleep.com. Dr. Grant, good to see you again. We'll talk
Great
to you
to have
in a month
me back.
or so.
Thank you.
All right, coming up next, PGA Golf. It's the final major. We'll be back with that. It's Matt Miller, 1460 KXNO.